Human immunodeficiency virus, or HIV, is a virus from Retroviridae family, specifically a lentivirus, which can further cause acquired immunodeficiency syndrome, or AIDS. HIV is an enveloped single-stranded RNA virus, which has proviral genome DNA intermediate that can integrate with human host cells' DNA. If someone is infected with HIV through direct blood infection or mucosa after sexual intercourse, the virus will then enter human host cells, specifically CD4+ cells like T cells, macrophages, and dendritic cells that are all stored in lymphoid tissues to replicate. Mainly, HIV will replicate in lymphoid tissue of the GI tract, or we call it as gut-associated lymphoid tissue, or GALT. HIV's RNA will duplicate to a double-stranded viral DNA with the assist of reverse transcriptase enzyme and then integrate with the host cell's DNA via integrase enzyme, resulting in the replication of the virus. Then, how to determine if someone is infected with HIV? First of all diagnosis starts with depth interview and physical examinations. It is possible to suspect an HIV-infected person if he or she lives within endemic area or exposed to risk factors such as using narcotics, doing free sex, sharing intravenous injections, and fertile infections from mother to offsprings. However, HIV infection is usually asymptomatic and will only produce symptoms such as fever, fatigue, rash, lymphedema, and headache within weeks after infection. Worsened immunocompromised condition usually took 2 to 10 years after infection, will then lead to opportunistic infections or even malignancies, and the condition is called AIDS, where the patient has T cell count less than 200 cells per microliter in laboratory examination. Currently, there is a detection method using rapid test. The test uses our serum as the sample and will detect the antibody against HIV antigen. If the T line and C line are present, then the person is suspected for HIV/AIDS. But if only the C line is present, then the person is free of infection. The rapid test is widely used and has specificity and sensitivity of above 99%. However, it usually takes weeks to months for our body to produce the antibody against HIV antigen. The process of developing new antibody, called seroconversion, usually happens 4 to 12 weeks after the infection. The bad news is, there is currently no cure yet to completely heal someone from HIV/AIDS. The available therapies are intended to limit the viral load and activities, and thus increases life expectancy for the survivor. The gold standard of therapy against HIV infection is antiretroviral therapies. The regimen used includes inhibitors of HIV enzymes and analog of host immune cells, like analogs of nucleoside, nucleotide, and non-nucleoside. Some antiretroviral agents include zidovudin, tenofovir, nevirapine, and many more. HIV cannot be transmitted from the saliva or skin contact. It can only be transmitted through direct blood inoculation, through wounds, breast milk, vaginal secretion, or semen. So then, kissing, hugging, shaking hands, and sharing foods with HIV-infected person will be unlikely to infect ourselves. Nonetheless, it is already a stigma that HIV-infected people are highly contagious, and discrimination towards them is common. those kind of discrimination will just worsen their condition and eradication efforts. As a future clinician, it is important for us to know how to approach an HIV-infected patient. Knowing the characteristics of the disease is a must. However, that is not all. We are bound to fight the stigma and discrimination felt by the survivors. Hence, interpersonal communication skills are also important. During the session, we have to show our empathy, as well as understanding the needs of our patient, including their perception and beliefs. Empathy means understanding the feelings and emotions of someone else, such as feeling the same amount of happiness with others, or showing our condolences, and even doing something to comfort others, and so on. To show our empathy, it is important to mind our paraverbal acts, such as eye contacts, body posture, speech tones, and else. Studies have shown that satisfaction of patients with healthcare increases patients' life expectancy and quality of life. Based on the explanation above, it is very important for us to learn how to communicate well with patients starting from now. Because all patient and doctor relationship begins from communication, in other words, depth interview. How to perform that? Find out more at Skills Development on National Leadership Training 2019 by AMSA Universitas Pelita Harapan on 12th to 14th April 2019. Thanks for watching.